supplies, knock, 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 and hygiene. Hi, my name is Caitlin. I'm a student nurse with Kilgore College. Before we get started, do you mind just confirming your name and date of birth?
Caitlin Harris, 5/19/98.
Perfect, thank you. And do you have any allergies I should know about?
No.
No? Okay, great. And are you in any pain today?
No.
No? Perfect. Do you know where you are?
The doctor's office.
Okay, and do you know why you're here?
For a chest and abdomen assessment.
Okay, perfect. So as you just stated, we're gonna be doing a chest and abdomen assessment on you. The first thing I'm gonna do is get some of your vitals. So I'm gonna start with your blood pressure. Do you know your height and weight?
I'm 5'7" and I'm 130 pounds.
Excuse me. Okay, and then have you had anything to eat today?
Yes, I've had 2 kolaches and a salad.
Okay, perfect. Any water or anything?
Yes.
Okay. Okay, your blood pressure was 110/64. I'm gonna go ahead and take your pulse. So I'll have you place your hand over your chest. Thank you. Okay, perfect. It looks like your breaths per minute were 16, and then your pulse rate was 64. All right, I'm gonna go ahead and take your temperature as well. You'll just open your mouth. Okay, beep, beep, beep. Your temperature is 96.4. Sorry, it was 98.7. All right, and I'm gonna take your pulse ox. Okay, looks like your oxygen was 96%. Alrighty, the first thing I'm going to do is I'm going to be inspecting your chest. So I'm going to inspect the anterior and the posterior portion of your chest. And for the purposes of this video, we're going to keep you clothed, but typically we would do this underneath your clothing. After inspection, I'm going to go ahead and palpate your anterior chest. Okay, and then I'm going to listen to your lungs as well. Now I'm going to move to the back. I'm going to listen to your lower lobes. Have you been experiencing any coughing lately? No? Okay, perfect. And then I'm going to go ahead and move on to your heart sounds. I'm going to be listening to your heart. palpate your PMI as well. I'm just going to be feeling for this pulse. Okay, perfect. The next thing I'm going to do is I'm going to be inspecting your abdomen. Can you tell me when your last bowel movement was?
This morning.
Okay, and what would you say your bowel and urinary patterns are like?
I go to the bathroom every day and I urinate once every 2 hours.
Okay, and do you have any trouble with that at all ever? No? Okay, perfect. All right, I'm gonna go ahead and have you lean back for me. All right, are you comfortable?
Yes.
Okay, and are you having any pain or tenderness in your abdomen?
No.
No, okay. So the first thing I'm gonna do is I'm gonna be listening to your bowel sounds. Great. I'm gonna go ahead and percuss. I'm just gonna be kind of tapping on your stomach a little bit. Okay, and then I'm gonna be palpating. So I'm gonna be, you'll feel a little bit of pressure. Okay, great. You can go ahead and sit up if you'd like. I'm gonna go ahead and lower your bed to the lowest setting. That way you're safe. Are you comfortable right now?
Yes.
Okay, here's your call light. If you have any questions, just let us know. I'm gonna go ahead and go and talk to the provider and go ahead and document hand hygiene. Okay, the client was alert and oriented ×4. Her skin color was as expected for ethnicity. She was calm and cooperative. Her facial expressions and body language was relaxed. Her nutritional needs are met and her personal hygiene was well. During her chest assessment, her chest rose and fell evenly in the anterior and posterior portion. Her breath sounds were equal and clear in all lobes bilaterally. Her chest was also symmetrical, anterior and posteriorly. And her heart sounds, I heard S1 and S2, no S3 or S4 was noted. Her PMI was regular and with an amplitude of +2. And then during her abdominal assessment, there was no distension noted. Her bowel sounds were normal active in all 4 quadrants. During percussion, I heard tympany in the upper 2 quadrants bilaterally and dullness in the lower 2 quadrants bilaterally. There was no pain, tenderness during inspection as well. She stated her last bowel movement was today, and she states that there's no problems with her bowel or urinary patterns. And then during palpation, I felt no masses, nodules, lumps, or anything like that.